that we're going to meet two of the organizations that are supporting the Mid-Atlantic Conference later this year. And let me first kick this off with Steve Lawn of Advanced Nursing and Home Support. Steve, great having you, and thanks for supporting the conference.
Of course, and we've been longtime supporters of Alka, and we're really thrilled to be doing it again. We're also thrilled that it's local, so we don't have to travel as far. But we're really excited, and it should be a great event.
Yeah, so I've got your slide deck up there. Hopefully everybody can see it. But tell us a little bit about advanced nursing and home support.
It's actually home care.
Oh,
We
home care.
we
Sorry.
went through a that's okay. We went through a brand refresh because we celebrated our 30th anniversary last year. So we're very proud of that. Steve, if you can go to the next slide there. So we're local in business for over 30 years. We're award-winning. Home Care Pulse, we've received all three possible awards for them, 6 years running. And so we're very proud of that. We're actually the only agency in Montgomery County to do that. We serve clients in Central Maryland and also in facilities in DC. And we provide the entire continuum of care. So everything from a simple companion all the way out to an RN, so that Steve, they're saying the slides are
Oh,
not displaying.
yeah. Can you all
Uh,
see it? Can you all see the
Panelists
slide?
can see it.
Okay.
Um, that's okay. You don't really need to see the slide. You can just look at this beautiful face. So, and the reason, being able to offer care at every level is that you never have to change agencies, and so that you can age in place and advance your well-being. Uh, and that's us. So we're thrilled to support. Aging life care managers are such a crucial part of what we do. And I'm looking forward to listening to the panel and sharing with you all, how they can benefit you.
Yeah, and Steve, before I jump over to Sean, who's another sponsor, just from your perspective, like how do you see like a home care provider like you, how does working with aging life care managers help with your clients?
Absolutely. Well, I think because aging life care managers really do a deep dive with the client, so they are not only getting to know their medical needs, but they're getting to know them on a really personal level, and helping them navigate this vast world of senior living, from facilities to agencies like ours, to just managing their day to day and their doctor's appointments and things like that, that really having them as a lifeline and an advocate for the client is really invaluable for us to be able to provide the best care possible.
I love it. I'm sure that when somebody comes to you as a client from an aging life care manager, that it's a lot more streamlined than without. So thank you
Absolutely.
so much for the support. Now let's jump to Sean. Sean, I'm really charged up that you're supporting the conference because you've got a really unique uh organization and community that you're a part of.
Yeah.
You want to tell us a little bit about that?
Yes. So first, let me say, Steve, thanks for putting these on. These roundtable discussions are awesome. I know getting information from care managers, as Steve said, is really valuable to this provider community. So it's great. We all thank you for the hard work that you do, and thanks for the opportunity to tell a little bit about our community. So, Inspire Embassy Row. It is a community that's really unlike anything else in the downtown DC luxury assisted living and memory care market, really. Basically, it's a community that's located right off DuPont Circle, and we are hoping to have residents that want to be at the center of the city or want to continue living in the center of the city. And it's really been an underserved market for a long time, where if you're a resident of DuPont Circle or Capitol Hill or Georgetown, there are not a lot of options for luxury assisted living in the downtown market. You have to go outside to the fringes of the city or outside of the city altogether. So we think it's a really unique value proposition, and believe that it'll be well received in the market. So very excited about that. Let me tell you a little bit about the building itself. It's 174 apartments, 45. Oh yeah. You can go to the next slide, I guess. 145, 45 of those 174 are designated as memory care. So those are going to be secure neighborhoods within the building, and they'll be able to take part in the programming that we offer and everything else. For the remaining apartments, there's a combination of 2 bedrooms, 1 bedrooms, and studios. And this is a renovation of a historic hotel, right on the Fairfax Hotel. So each room has its own sort of character, different square footages, different views, styles, and things like that. So the building's got a lot of character, and I think that's going to be part of the charm of it. The building is going to be extremely well appointed, and it's a spectacular space. But the focus of what Inspire as an organization does is really on the resident and their well-being, exceptional care. Delicious food is obviously important to all of us. And one thing that I've really taken to heart since joining the organization a couple of months ago is the hospitality and the focus on hospitality. So there, from a well-being standpoint, we've got amenities like a spa, incredible spa with a fitness center with all the bells and whistles, coaches to help plan workouts for our residents, a saltwater rehabilitation pool, steam room and sauna, massage room, even a Himalayan salt room, which is offers benefits in recovery and respiratory benefits. So we're really excited to offer that to the residents. So lots of amenities, but experience and connection is a huge part of aging, obviously, as we know. And so actually, Steve, you could go back to the previous slide if you don't mind. And so we're going to be curating like really intellectually stimulating authors and one-of-a-kind speakers to come into our building, as well as going out on excursions to all of the places that the city has to offer. So we're really thrilled about that. In fact, we had a really nice an author come in and do a really nice presentation last week to some of our depositors and prospects. It was really outstanding. This is great that you're on this slide here too. So again, when you have a beautiful building, it's very easy to talk about the amenities and all of that stuff. The rubber hits the road with care and hospitality and how we make people feel. And so we've got this integrated care model that Inspire has, perfected. And really what that means is it's a person-centered, collaborative approach where care coordination and communication is paramount. So whether it's our care team working with a resident and discussing it with our clinical team, or whether they're working with a provider, like some of the members that are here on this Zoom today, we want to be able to communicate and make sure that our resident is getting exceptional care and communication throughout the process, so they come back to us through those care transitions. So we're scheduled for a January 2025 opening. We are on track. We've built out some back office staff people, and our director of clinical integration and our executive chef started this week. And as soon as we're ready to invite people in for tours and things, we'll do that. So we're really excited about it.
Yeah, Sean, drop your contact into chat. And so folks, I highly recommend, reaching out to Sean and his team, learning about this, especially if you're serving older adults in the DC metro region. And man, thanks so much, y'all. So now let's turn our attention to our panel members. We've got 3 leading aging life care managers in the Mid-Atlantic here today. And Colleen, I'll start with you.
Wonderful. Thank you. Well, thank you, particularly panelists, presenters and sponsors. I am the one of the Mid-Atlantic co-chairs for this conference. So I love that we have sponsors here. Thank you so much. We couldn't do what we do without you. We have some wonderful, I'm the co-chair of the speaker side, so I'm delighted to say we have some wonderful speakers. I invite you to register for the conference. If you're a care manager and you haven't registered, please do. Again, we have some wonderful speakers. And then we open it up to people who just want to hear this great content. So please think about registering. It's in Bethesda, it's November 4. And then we also have a few sponsor slots available and quite a few exhibitor spots. We're trying to make sure that we have a good range of exhibitors so that it's not all one type of company. So get in your registration early. I know lots of people, I looked at the people who are joining us today, registered here today, and I know that quite a few of you might want to be exhibitors. So please don't hesitate to do that. We'd love to have you.
Awesome.
So thank you again for those of you that have sponsored and will sponsor.
Great. Thanks, Sean and Steve, and we'll look forward to seeing you at the event.
Thank you.
All right. So now let's get to know our care managers. Since you've got the mic there, Colleen, tell us a little bit about yourself.
I'm Colleen Duewel. I am the founder of LionHeart, Eldercare and Consulting. We're here in Northern Virginia. We are a care management organization that focuses primarily right in kind of inside and around the Beltway in Northern Virginia. We also have friendly visitors or engagement specialists. We are honored to be serving this community.
Excellent. I love it. All right. And then Joanne, how about you? Tell us a little bit about you and your organization.
Sure. My name's Joanne McCarty, and I am a part owner of Independent U. We're located in the Fairfax area. We serve a big chunk of Northern Virginia. Our rule is kind of we will go, we'll go about an hour from the Fairfax office, depending on how involved we need to be. If somebody's in a community, it's a little bit easier because then they have a first line person. But if they want, us to go to the emergency room or something, I usually say about half an hour from our area. But
Right.
Arlington, Alexandria, Burke, I have a couple clients out for a little further. We have care management and home care at Independent U. Been in business since 2010. I have an amazing team of care managers made up primarily of nurses. We have social work, we have an OT, we have people with lots of experience in senior care. We also have a Helping Hands program that sort of is a right hand to the care managers that help us do some things that they're a little bit less expensive, more social engagement than the care management part. And it's a great job. I've been a nurse for 38 years and never been able to do anything as impactful, I think, as being a care manager.
I love that. All right. And then let's meet Ellen, and then we'll dive into the discussion here. So Ellen, tell us a little bit about yours. And folks, just so you know, Ellen had jury duty, and then this morning she found out that she got off. And so A, number one, I'm glad that you're here, and B, I'm so glad that Joanne jumped in just in case that jury duty was gonna be activated. So it's great to have you this morning.
Thank you, Steve. I appreciate it, and thanks for being agile. Joanne, thanks for stepping in, and Colleen, as a prior co-chair for the Aging Life Care Association, I know how much work goes into doing a conference, so I appreciate you doing that, as well as our sponsors. I'm Ellen Platt with the Option Group. We do private case management and advocacy in Maryland, Delaware, and Pennsylvania. We provide advocacy, care navigation. My background is in physical medicine and rehabilitation. So we also, in addition to people with dementia and older folks, we tend to get some younger folks who maybe have special needs or disabilities at a younger age, and they need somebody to help them with that care navigation as well.
I love it. All right. Okay, folks. So now we know who we've got on the stage here, and now we want to sort of engage in an open discussion on everything aging life care. But before we do that, because I know there's people in the audience or people listening to the recording that's like, you're here because you don't know what an aging life care manager does or is. And so, Colleen, you want to just take a broad stab at the overall definition of aging life care, and then I'm excited to have each of you sort of share just some insights or case studies, and then for our audience to jump in. Folks, if you got questions, use Q&A and chat, and we can have a great discussion today.
Thank you. I wish that I had a perfect short answer for what we do, and I actually asked my co-panelists if they did. So I'm going to give you my best shot at that, which is we are healthcare advocates and navigators, typically for older adults and their families. And what that means is it might be a short-term thing. Somebody just doesn't want to use Google to figure out how to solve this problem. They want somebody who has deep knowledge, resources, and experience. Or it can be, you know, we need you to manage every single thing for us. So we have people that just use us for consults, and we have people that we are essentially their professional adult navigator, their adult daughter. One way that I talk about this is, and I got this from a colleague, if you think about a wedding, what do you want for your wedding? What is, what's important to you? What's your budget? What are you like? And that's how we think about aging. We always start with what's important to you, what matters to you, where do you see this happening? Who do you want to have be involved? And what's your budget? And that's what we do. We, as part of our profession, we don't have any financial relationship with anybody that we refer you to. Those are relationships that we've developed. They are people that we know, companies that we know are going to do a good job for you. And we don't get any kickback from referring them. So we find out what's important to you, and then we bring all of our resources in to help make sure that you have what you want. And I would say that can be in a bunch of different ways, and you'll hear all about it.
I love it. And also, well, Colleen or Joanne, you want to add anything to that? But I dropped the definition right off the Aging Life Care website if anybody wants to refer to that. But I really liked how you described it, Colleen.
Colleen and I were sort of texting or chatting before, and I usually, because people call up all the time, they do find your name on Google, or they go on the Aging Life Care website, and they don't really know what a care manager is. So I tend to do the wedding thing that Colleen was talking about. I will say to daughters of older adults, we're like another daughter. We do all the things that a daughter would do. And that is to describe what we do is everything. Change litter boxes, not personally replace water heaters, but call when the water heater breaks or the air conditioner breaks. We do medication management, manage appointments, all different kinds of things. And then for sons or the male population, I may say we're the quarterback. We're the person that is the one person that is getting all that information, because there's so much information out there. And I know if anybody's taken their loved one or themselves to the doctor in the past couple of years, you walk in the door, they hand you an iPad and they say, register or fill in. And, it's floundering. It's very difficult to navigate all those little things. And like Colleen said, some people just want the resources and then they're going to handle it. And other people they say they're going to do that. But then as they start seeing how a care manager can help and the connections we have and what's in our toolbox, it's such a relief to the families and to the clients that we work with. It's the most rewarding, like I said in my intro, thing that I've ever done, to be taken seriously. People are coming to us because of our expertise and our ability to collaborate. And that's just a really great thing to be involved in.
Great. This is great. And I already see questions coming in. And actually, I know each of you has some things that I'd love for you to share, but let's take a look at some of these questions. Because I've often found, hey, look, if we can answer the questions of the audience members, they're gonna all be really happy with us. And I'm not sure which website this person went to, but it says we have friendly visitors and full engagement specialists. And she says, wonderful titles. How are family members to know how to choose and what the titles mean? Thank you so much, and I'm grateful for all you do to navigate with family members. But let's talk about that. Friendly visitors and full engagement specialists. Is that are those some terms that either are of your companies are utilizing?
That might be directly, sorry to jump in, but that might be directly from ours because those are the titles that we use. We have friendly visitors that are engagement specialists. So
Okay.
this, and I want to invite both of you because I know that you all, my colleagues, do that as well. But kind of like Joanne said earlier, there are things that we do that are very intensive. They're navigating care, they're solving problems. And one of the things that I consistently find with older adults is that people are doing things for them or to them, but not with them. And so we really have those friendly visitors and engagement specialists to be with that person so that when that person is there, they're not trying to solve a problem, they are engaging. And that may be somebody with a cognitive change, maybe somebody with a disability. It may just be somebody who doesn't have anybody around. So we charge a lower rate for that, but I have to say that that is the thing that often our clients value the most. And I can tell you that our friendly visitors and engagement specialists love what they do because they get to be there and be with that person doing whatever it is that delights that person.
I love it. And Joanne and Ellen, have you seen similar experience? I think sometimes also the language that we use where, hey, mom, I've got a visitor for you instead of a caregiver or what have you can make a difference.
With our organization, it's very similar. We have engagement specialists and people that do wellness visits. We have nurses and social workers and people have had experience with hospice and wound care. And so if you hire us, you have the benefit of the entire team. So if we need to pull somebody in who, if it's medically complex, we can get a nurse on it. If they just need that companionship and that wellness visit, somebody just checking in, making sure they've got groceries and are set up for the weekend or whatever it might be, or do engagement activities to kind of engage the brain if they're in early stages of dementia. So we will do that. And it's individualized. So it's based on what's most helpful for the individual receiving services and the family who's trying to support them.
I love it. Okay. I'm going to jump on Emma's question here because it's a hot topic right now that and what Emma says, do your services also provide quality filtered referrals for solo agers that may need or want? A key area is identification of persons with whom they may ask to speak about assuming the role of executor and or other major roles as a solo ager prepares for his or her plans and various contingencies. Great question, Emma. And I'm constantly referring aging life care managers to people that identify as solo agers. Would any or all of you like to comment on that?
I would say that the sooner people make a connection with an elder, with anybody in the elder care service area, the better. People wait too long and then there's a crisis or there's no will or there's, so, when they ask who's your perfect client, it's probably somebody that's, 70 or maybe even younger, to say, just let me put things in order. Let me make some recommendations. Who's going to pay my bills? Who's going to make my decisions for me? Who's going to show up in the emergency room when I end up, something, when something bad happens? Aging life care professionals will talk about stuff like end of life. At least I do, from the beginning. What are your wishes? Like Colleen was saying earlier about, like a wedding, like what do you want the end of your life to look like? Do you want to be at home? Do you want to live outside of your home? So a lot of those things, we can plan for and prepare for You know, and typically aging life care professionals try not to get involved with paying bills and money things. So we do work with, you know, bill payers or people that can help do that. And, you know, we work very closely with the elder law community. And so, you know, anybody that's doing their wills or trusts or needs advocates, that's a really good place to start.
All right, this is great. How about Colleen and Ellen? Any insights on on solo agers and specifically like the executor? Like this is, I'm constantly getting the questions on our discussions. It's like I just don't have anybody that could be, you know, an executor.
So what we've done is that we have taken on the role, in some cases, as the power of attorney for a solo ager who doesn't have anybody who can step in the event they're not able to make medical decisions. Now, in terms of the executor of the will or somebody that does the financial piece, I see most of the time it's an attorney who might take on that role, and we just collaborate to make sure this person has what they need.
Colleen, any thoughts?
Yeah, I'd kind of say a combination of both. One of the things that I love most, just like Joanne said, is working with people ahead of time to kind of anticipate that in advance. So one of two takeaways that I always say is please, 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 before you do anything, have an estate plan in place. But then that gets exactly to what you're saying, Steve, which is, okay, I had it, but now my sister lives in California and my husband just died, and now what do I do? So I would say it starts with a conversation with us to think about what those options are. Like Alan, we will, in some rare circumstances, serve as somebody's healthcare power of attorney, but we will also help identify other options for serving as your durable power of attorney. I know there's a daily money management group that we work with a lot that will serve in that role. There are also potentially people, sometimes a financial advisor will do it or a trustee. It's worth a conversation to figure out the right match for you. The other thing I'll say, and I got this from a financial advisor I work with a lot, is people really feel like, well, the only type of person that would name a professional is somebody that doesn't have anybody else. But I will say that sometimes a professional who knows what they're doing might be the best fit, and let your loved one do what they do well. Let us be navigating that for you, and your daughter or your spouse is there with you, attending to your emotional needs in a way that we're never going to be able to because we haven't known you our whole lives. So sometimes thinking about using that is actually a success, and not, well, I don't have anybody else. So it can be the right option for some people.
I love it. And thank you, Emma, for that question. And that's great. Okay, let's see. Okay, well, this kind of stems into that question. Do any of you have staff or references for people to handle finances for clients with no family to help them as they age? I get asked questions about this from time to time. I mean, a lot of people don't realize there's a profession called daily money managers. Is that a profession that you generally work hand in hand with? Because you guys need to have an arm's length, have no interaction with the finances because you're providing services. Am I correct on that?
Yes. We use, I think Alka partners or has somebody, the daily money managers, but we've got people locally that we use. And if it's somebody that we like, and they do a good job, then we will refer them to the clients that we work with.
And I'm going to drop the Daily Money Manager link into chat there for everybody. Okay, I knew this was going to come up too, and then I promise, I know some of you I know you've got some great tips to share, maybe a case study or two. But Catherine asks, what is the range of the cost for these services, and specifically like the engagement versus a care manager or support? And do the friendly visitors, will they help people prepare their meals and maybe go on some appointments?
I think,
Oh, go ahead.
go ahead.
I was going to say we call our friendly visitor, we call them helping hands, and that is $65 an hour plus mileage. And that is from the time that the helping hands leaves their house to the time they return. So once they're with the client, or once they, you know, are out doing things, they can take them grocery shopping. They will help prepare like a light meal, but it's mostly like social things like the other ladies were saying. Or if somebody wants to plan a birthday party, or they want to buy Christmas presents for their grandchildren, it kind of helps the client, you know, do those things that they were used to doing, that it's much less expensive to pay a helping hands person than to pay us. And we can use them for doctor's appointments. It depends on what it is. I tend to use the helping hands, not that they're not able to, but I would use them more for like dental and vision. But if I'm taking to primary or neurologist or cardiology, I would, you know, that's what I would use them for. And then do you want me to talk about the price of care management, just to kind of throw it out there?
Well, and we can talk about it in a range. I mean,
Okay.
thank you for sharing that. And I know, because I've done so many of these discussions, folks don't like fall out of your seat because it's like, hey, $65 an hour or whatever it is. Most of the care managers are very creative to work within people's budgets, you know, and but yeah, go ahead, Joanne, if you'd like to share your rates
Sure.
or range for the Northern Virginia region.
Yeah, I mean, I would say in Northern Virginia, it's probably between 165 or 170 all the way up to 225, something like that, maybe higher. And it's an hourly rate. Some of us charge mileage and travel time from our office and to the client wherever we're meeting them, or if we're taking them to a doctor's appointment. We do bill in 15-minute increments. So you know, a quick 5-minute phone call we don't charge for. Once it starts going over 15 minutes, then we do charge for that. It is all private pay. Some long-term care insurance will cover it. We find that with nursing, if we're doing medication management or sometimes taken to a doctor's appointment, long-term care will pay for it, but it's private pay out of pocket. But like my colleague said, we are all held to a standard and ethic as part of the aging life care, and we are very creative in how we use our time. We try to do, you know, bulk visits in the same area, so maybe we're, you know, seeing a couple people in the same facility or the same vicinity at the same time. I know for a lot of us, we've talked, we all, you know, we own our own businesses. You know, you do what you have to do. I mean, people, sometimes, you know, when you get the phone call or referral that this person just cannot afford things. And so you give free information and you help them out and do your best and try to accommodate. You know, we're getting younger and younger family members now. You know, I talked to we got a referral last week, a client that's 60 years old. He's the client and the son is in his 20s. He doesn't know anything. I mean, it's just incredible. You know, the stressors that people are dealing with right now. Everybody's working. It's a lot. They're not happy to pay, but they're willing to pay because they know that it's a good service that they need.
Yeah, no, this is great. And Ellen and Colleen, any insights on cost? I know it's a question that always comes up on these discussions.
Yeah, for us, it's pretty much the same what Joanne and Colleen have been saying. We have some people that can do things at a lesser rate. There are even times where we may pull in, we don't provide caregivers like a care agency, but we might even refer to a care agency if money is an issue and they just need somebody to get them where they need to go or help with groceries and things like that. You don't necessarily need an RN or a social worker to help you with that, but our caregivers are trained to be able to kind of handle people, but sometimes a home care company would be enough for what they need. And then we will take on the higher level things, the appointments at the neurologist or the primary care when we're talking about medications or change in their treatment regimens. So we want to be sure that we are there to hear that information to be able to put it in context, be another set of eyes and ears, and often communicate to family who's in another state.
Okay, and then Colleen, I'll give this one to you, but anybody can answer. But Susan said, are there other fees clients should know about, such as assessments? And I guess like an assessment, am I, for a lot of your clients that come to you, one of the first orders of business is doing an assessment. Actually, how long does a typical assessment take, and what could be the expectations on cost there?
So let me kind of answer that question in two parts. The first is I became a care manager unintentionally, as many of us do, in navigating care for my father who lived in a different state. And I didn't know that care managers existed. I flew back and forth many, many, many times. I think I've made 7 trips to Texas in 6 months, in the first 6 months. And had I known there was a care manager, I could have saved myself thousands of dollars and avoided so many mistakes. So I think there is a cost effectiveness to it. I also know, because I know my colleagues in this area, that we will always make it work. I would say we'll do whatever it takes to solve the problem. And that can be as little or as much time as you need. In terms of assessments, and I actually welcome hearing from Joanne and Ellen on this. The old style, I'll call it old style care management. The traditional care management style is you come in and you do a full assessment and a care plan and you present that to the family. And what I have found over and over is, unless there's a specific reason for that, maybe there's a court case, maybe they're contentious adult children who have very different opinions, or there's a very specific reason to do a very comprehensive care management assessment, what I kind of call the capital A assessment, that is not typically what people want. We ask them, what made you pick up the phone today? And that is the thing that people want solved. And that is how I usually start. Every once in a while, and I feel like I'm Lucy or Charlie Brown with the football with this. People say they want an assessment. We want every single resource. We want you to come in and look at everything and give us a written out grid care plan. This is what we solved. This is the solution. This is the timeline. This is who will do it. We will do that. We're happy to. And every time we do that, people buckle under the weight of everything that needs to be done. It's like entering college on the first day and saying, this is everything you need to do by the end of the 4 years. And people are like, I don't think so. So if you want a full assessment, sure. I know that we charge hourly for that. I think most people do. I'm interested to hear what you all do, but typically we say, where's the pain point and what do you want? Not just what the hard part is, but what is the goal? And then we work towards that. And then as it makes sense to do additional things or to provide additional information, that's typically what we do. And one more thing before I stop talking. There's sometimes a mismatch between, I get a call from an adult child who says, I'm concerned about this, this, and this. Will you go meet with mom or dad? Mom or dad has a very different thing that they're concerned about. And then we going out have a very different thing than has been mentioned so far. But we always start with what the client wants. If the client says, I need more engagement, I need a good resource. I can see my lawn is growing. It's driving me crazy. I can't sit here and look at my long lawn anymore. We're going to get their lawn fixed before we start talking about those medication bottles that are expired. We're going to talk to the adult children about we will absolutely talk about those medication bottles. We're not going to ignore it, but we're always going to start with what's important to that person. We want to be on the same side of the table. So that assessment starts with what will make a difference. And then I do see a question here, long-term care.
When will long-term care start covering care management?
Lots of long-term care insurance plans do cover care management, John Hancock in particular, but it's always worth taking a look at that long-term care policy, because many do.
Yeah, and I think some of the long-term care insurance programs want a care manager to, that's where an assessment might be required, is specifically for a long-term care insurance policy to pay. Okay, let's see. Ellen, I know that you had mentioned to me before we jumped on that you had a little case study scenario. I know we got a few questions, but would you like to sort of share this scenario with us? And that can
Sure.
probably.
Yeah. It's a case that I happened to think of when we were talking about doing this, and it's a case that really exemplifies kind of the vast array of services that care managers provide. I mean, yes, we do care management, care coordination, we'll do crisis intervention, but this particular case was somebody who was in their early 70s and they had a neurodegenerative disease, which left them bedridden. And they were living in a house that was full of black mold and hoarded, and at the time had 17 cats. So that was the year that I said I was a geriatric cat manager instead of just a geriatric care manager. But they had people living in the home who were acting as a caregiver, but they were really taking care of their bank account and not actually this person. So it came to us through a home care company that says, we can't go in. We don't want to put our caregivers in danger with the black mold and the cats that are not vaccinated and all this kind of stuff. So we went in, we were able to do an assessment, really figure out what was going on. And we were able to, do that assessment. We coordinated mold remediation. We were able to evict the people that lived in there that were squatters, and they were bringing in friends and multiple generations, and really just taking advantage of this woman. We were able to get her a Medicare benefit because she had never signed up for Medicare. She was paying for all of her medical care out of pocket, but also had deferred her medical care, really wasn't getting any. So we were able to corral the cats, get them adopted and treated, and some came back with her. But eventually we were able to move her to an assisted living while they were doing the mold remediation. And while she was there, she actually found that her condition improved. She was very foggy cognitively because of the black mold. She wasn't making good decisions. And she found that when she got 3 square meals a day and people were taking care of her, that she was feeling so much better. And so she decided that she was actually going to stay there. So we were able to help her with the clean out of the house, the mold remediation, the sale of the house. Of course, we don't do that. We're not real estate people, but we are connected with people who have been vetted that we've done a good job and we're able to provide options. So she was feeling better, decided to stay in assisted living where she was getting a lot of really good care. And then she got back to her volunteerism. She was very involved in philanthropic entities and fundraising. And she was able to do that from her bed. And she cognitively and endurance wise was up to doing that. So we kind of did a whole lot of things that kind of shows the dexterity of a care manager.
Yeah, well, and what I like is that this case was referred to you from a home care agency, and that's great because it's sort of like that case clearly needed a quarterback or a wedding planner. Like for a home care agency just to come in there and try to provide quality care, that would be very difficult without your services. That's a great example. Let me throw out to y'all, Allison was asking, have any of you worked with end-of-life doulas or are interested in working with them? And I put a link to the End-of-Life Doula Association and a definition of what an end-of-life doula is. But let's also just in general share with us some of the ways that you all work with families at end of life.
I am an end of life. I'm trained as an end of life doula.
Oh,
I
wow.
was a
So
labor
a
doula.
yeah.
Yeah. When I was in the younger part of my life, I was a labor doula, and now I'm trained as an end of life doula. I seem to be a little too busy to do that now, so we bring in people who are really focused on that. But all of that is supporting that need, and that time, it's having those conversations. I think that time can feel so hectic and not sacred, to use maybe a sensitive word, but people are making literally life and death decisions, And it can get so that what you're worried about is who's going to worry about medications and what about doctor's appointments? And can somebody just pause all of that and say, none of us know how much time we have left, what's important to you, and then hold back the chaos and let that person have that time that's important to them. And that is something that I think we all hold really dear, is that we do see people at the end of their life. And it is very easy in this area to have that all be just consumed with tasks and communication and ridiculousness with navigating the healthcare system. But how do we bring in the right supports so that you can connect with the people that matter to you and the things that matter to you? I think that's really important. And I love that question.
I love it.
Yeah, the other thing that we do, Steve, is that we might engage hospice, might bring hospice to come in to provide that end of life care, maybe before it gets to a doula, or maybe even palliative care.
Yeah, I think there's some local hospices that have doulas on staff to work with them. But I agree that hospice, that's another hidden gem that people are always reluctant to start because they think that means they're going to die, in a week. But it's such a great resource. And when the time is right and people understand that, it's like they focus on completely different things, and they really look at the person who's dying and how to make their wishes, they don't want to take any more medicine. They just want to eat chocolate ice cream or whatever it is. It's a really great service.
I love it. And several people, that was a great case example there that you shared, Ellen. Let's see. RH asks, what kind of experience do sort of the helping hands friendly visitors engagement specialists have? I'm like, is there a certification for these individuals, or how does that work?
For us, they're highly trained. Like, we have MSWs, we have people that would be care managers in other aspects of they have the same training as a care manager, but they all are dementia certified. They have an interest in really spending time with that person. And they don't want to be on call. They're like, I don't, being a care manager is not an easy job. Not that engagement specialist is, but their particular interest is, I want to focus on that person and then not feel like once I leave, I have a list of 30 other things that I need to do for them. I think the other advantage of using a friendly visitor that is part of a care management group, like with Ellen and Joanne, is they're really like, they see the notes from when the care manager visited and vice versa. So they're highly matrixed in. So the care manager might say, hey, I saw Mrs. So-and-so today. She seemed a little down. When you go visit her, will you talk about such and such? So you're kind of getting that advantage of that interaction with a team that is a multidisciplinary team that can support that person. And then kind of related, when we're talking about the types of clients that we see, I would say for most of us, a lot of it is adult children. Recently, we've been seeing a lot of spouses. And I want to say my other take-home message here is, we're working with a lot of spouses who are primary caregivers, and it's been kind of a lobster in a pot. They have no idea how much they have taken over until they finally get to kind of a breaking point, or sometimes their own health is collapsed. We've had quite a few people who've been in the hospital and said, my spouse that has dementia or mobility issues is home alone now, and I'm in a panic about that. So I just want to say, my little message today is, if you are a caregiver, please take care of yourself. Figure out what resources we can help you with, your family can help you with, your community can help you with, to make sure that you have what you need. It's a big job that you have. We get to spend some time with you, an hour or so, and walk away, but you are living it. So please be sure that you're getting the support that you need.
Yeah. Okay. Let's see. Well, somebody is asking, and they're asking specifically for Northern Virginia, but if you were working with a care manager, could a care manager recommend a doctors who take Medicare? I know that this is something that a lot of people are challenged with, is that their doctor may have retired or maybe they relocated. Are you all able to help your clients identify their new practitioners if they need one?
I would say yes. That's a big problem because as our client population ages, their practitioners are aging as well. And they've had the same doctor for a long time. Sometimes they should have switched a while ago because they're not as swift in their decision making as they used to be, maybe. But yes, I mean that there's a lot more resources that for practitioners that come into the home now. We work with a lot of nurse practitioners that are amazing who come into the home. That's a good resource for people. And yeah, I mean, it is a challenge trying to find new doctors, but again, that's one of those things we have in our toolbox. We have the doctors and people that we like to work with, neurologists. So.
Here's a great question. And how about we kind of make this the last question and then we'll wrap up, because I see we burned through an hour. This has been amazing. But somebody says, could an aging life care manager help someone with a parent who might show signs of dementia but is refusing to get checked out? And I feel like I'm getting phone calls like this every day lately. Is that something you all can help with?
That's what we do. I'll hand it over, but I would just speak for all of us. That's the call that we get every single day. There's not a day that goes by that somebody doesn't call us and say exactly that. And what I usually say to that is, we don't go in and say, hey, this is so-and-so, your daughter called and said you have a problem and we're here to fix it. We just say, we are specialists in finding resources. Tell me what's important to you and I'll help you get connected with that. One daughter introduced me as a longevity specialist, which I'd never heard before. That's what her mother wanted to hear.
Yeah.
I almost went out and got a badge. But we're not going to come in and say, what's your problem? How do we fix it? We're going to say, what's important to you and how can we make sure you have that? Absolutely.
Okay. I lied. We have a couple more questions and I don't want to not try answering these, but Catherine asks, what's the optimal way to engage in a care manager and to get a plan put together in advance? And you know, Catherine, one of the things that I would say, and one of the reasons why we do these as panels, is and I'm going to bring up the Aging Life Care Association directory, but would you all agree that it's not a bad idea to call 2 or 3 and sort of get to know the flavor of the personality of the folks that are there?
Sure. You can go onto the Aging Life Care Association website, and in the top corner, it's either orange or green. It's a button that says find a care manager, and you put in your zip code and you'll get a whole bunch. I would recommend looking for advanced professionals. There are those of us that have, it's orange. There are those of us that have been doing this for 11 years, 10 years, whatever. Some people are more want a social worker. Some people want a nurse. Some people want, somebody with a lot of experience. But the fact that the care manager is on the Aging Life Care, that would weed out a bunch of, potential people that you wouldn't talk to. But yes, I think it's always good to call multiple people. The other thing I want to say, not just to plug ALCA, but we are very fortunate in our area, in the Mid-Atlantic and in Northern Virginia, that we have an amazing group of colleagues. And this forum allows us to collaborate with each other. We have a chat that we, like a listserv that we're always asking for resources. And it's, some things it's not suited for my practice, and I would refer them to another care manager. So we are, I think, continually professional and well-respected and very fortunate.
Great. And then let's see, Emma's how to find an elder care lawyer that might also become an executor. You know, Emma, on this one, I would say that talk to some aging life care managers about helping you with a plan or a loved one with a plan. And then they may be able to give you a few referrals there that if you were working with the aging life care manager, there was some collaboration. That's one approach. What do y'all think of that?
I think that's good.
Okay.
Like Colleen said in the chat that, anybody that calls Independent U, if their question is about care management, they will get me. I will call them back and talk to them and give them some, I'm not going to give my trade secrets away, but I will give them some information and tell them kind of how we can help and, what their sort of punch list is.
All right. Well, thank you so much. We've gone over an hour, not surprising. And I think we answered most of the questions. This is awesome. Folks, I'll get the recording up later this afternoon. Hey, Steve, you still hung in there. That's awesome. And real excited about next month's as well as the conference coming up. Any sort of closing words of wisdom, burning things that you wanted to share that we didn't talk about today? And otherwise, we can go out and enjoy the rest of the day.
Thanks for coordinating all of it, Steve.
Thank you.
You bet. All right.
Thank you,
y'all.
Steve. Thank you, sponsors. And we still have room for more. I can't not say this. We still have room for a few more exhibitors and sponsors. So please, if you're thinking about it, get in there before we have to shut it off.
I love it. All right. Everybody have a great rest of the week and enjoy the end of summer. I can't believe we're saying that. So,
Okay, don't say that.